If you're thinking about signing up for health insurance through Obamacare, also known as the Affordable Care Act, here we'll explain exactly what you need to qualify. The first thing you should know is that in order to receive government subsidies, you must live in the United States and have a legal immigration status. This includes people with a visa, work permit, permanent residency, green card, or U.S. citizenship. Of course, you'll also need to have a social security number. Another key point, if you're already enrolled in Medicare or have health insurance through your job, you're not eligible for a plan through the Obamacare marketplace. Now let's talk about the most important factor, income. Your household income reported on your taxes is crucial in determining whether you qualify and how much financial help you might receive to pay for your plan. To receive a subsidy, also called a premium tax credit, your income must fall between 100% and 400% of the federal poverty level, as shown in the guideline chart. The lower your income, the more help you can receive. In fact, there are people who pay $0 a month for their plan, with low deductibles and low copays. In summary, here at Dulcinea Insurance, we break down what you need to qualify for Obamacare. You must live in the U.S., have legal status, and a social security number. Your income must fall between 100% and 400% of the federal poverty level. You cannot have other health coverage at the same time. If you meet these requirements, you could qualify for a health plan with significant financial assistance from the government. And of course, here at Dulcinea Insurance, we can help you get a quote and enroll for free. We're here for you.